Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic where we specialize in chronic disease reversal, and today we're joined by Thomas Briggs. And Thomas came to see us last year in 2018. Today is March 27, 2019, and Thomas is going to share his story with us today. He's done very well under our care. And so Thomas, tell us originally what brought you in, what type of problem you were diagnosed with.
I was diagnosed roughly a year ago with rheumatoid arthritis. After a lot of blood work, a lot of looking, finally diagnosed with rheumatoid arthritis.
Okay, and so you had seen a medical rheumatologist.
Yes, I did.
And what did the rheumatologist recommend for you based on your diagnosis?
Well, before he ever completed the testing, he wanted to get me started right away on methotrexate. And I know wanted the methotrexate, the steroids, and was also immediately recommending I guess they're called biologics. Anyway, something like that. That's what he recommended.
And this is a fairly common course medically when a patient sees a rheumatologist and they present with certain signs and symptoms and they get a diagnosis of rheumatoid arthritis. There's probably about 4, 5, maybe 6 different drugs that are prescribed, all with the intention of suppressing the immune system. So in rheumatoid arthritis, the immune system gets overactive, the person presents with a lot of swelling and discomfort and pain and inflammation. And so the idea medically is to just basically beat down the immune system and suppress the symptoms, but invariably it doesn't address the causes of the problem. It's one thing it doesn't do. At the same time, they come with a lot of serious side effects. And rheumatoid arthritis is one of the more common problems people come to see us with, and so we've seen all of the adverse effects that come from long-term drug use as prescribed by medical physicians for this issue. Thomas, tell us a little bit about your condition at the time and the symptoms that you were experiencing.
The symptoms was really body-wide inflammation, fatigue, it hurt to breathe. It was every joint you can imagine was inflamed. My jaws were inflamed to a degree that I could not chew food.
So this really significantly interfered with your life.
Oh yeah, couldn't get out of bed, could barely make it to the toilet, honestly. That was a 30-40 minute adventure to get
this was about a year ago.
Toilet. Yes.
This was about a year ago. Thomas, like many of the patients we work with who are diagnosed with chronic health conditions, are often told medically that their prospects of getting well are very slim, or none at all, because these problems are not solved by the medical care that's given. The best they have to offer are symptom suppressing drugs. They're labeled with a so-called chronic condition, meaning that the problem is ongoing, that it won't change and generally worsens over time, and the person develops side effects from the drugs. So Thomas today is living proof that recovery is possible from problems like rheumatoid arthritis. Thomas, tell us about how you're doing now. And by the way, did you take any drugs when they were offered to you a year ago?
No, I didn't.
No, so
I was scared of the side effects.
Thomas took no drugs at that time, and since then has been battling his way back to good health. And so I know you've had lots of ups and downs, and it's been a rough road for you at times. How are you doing now compared to a year ago?
It's light years difference. I feel fantastic. I know it's not a good idea to don't want any setbacks, but I feel like I could do anything I want to right now.
So you're now, as compared to previously, you couldn't get out of bed, had a hard time even getting to the bathroom, you were so inflamed. Now you go to the gym, you work out.
I do.
You exercise.
I do.
You do everything you want to do.
I do everything I want to do, and I feel like I could do more. I'm just out of prudence, I don't.
Well, yeah, we want Thomas to be cautious, at least initially, while he's still in the recovery process. But a year later, the difference now, and what would you say overall, compared to when you were first diagnosed, how much improvement have you had overall in percent since a year ago? How much of the way there are you at this point?
98% for the inflammation. However, the healthy eating habits and some of the things that I've had to do to get here it's improved my overall health in many other ways that aren't related to rheumatoid arthritis.
Not only got healthy with this rheumatoid issue, but you've gotten healthy all over.
I lost a lot of weight, I feel good, my mentality is better.
So Thomas has worked hard, and he's put forth the recommendations we've given him, and he's well on the way towards getting well, about 98% improvement. No treatments for Tom. Thomas took no treatments the entire time. Not a treatment at all, not from his medical physician, not otherwise. We had Thomas working and establishing the right behaviors in the right environment so his body could recover on its own, get balanced and get healthy. And that's what we do with all of our patients. Find out what factors have led to the development of this issue in that person, address those factors directly, and then build health. It's a very different approach to build health than it is to treat disease, which is what they do medically. And so Thomas is living proof that recovery is possible, and there are many other videos on our website which show that as well. And when people apply themselves and we're on target and addressing root factors and the patient is compliant, that the sky's the limit in terms of getting well. So Thomas, thank you for sharing your story today.
Thank you.
Your story will certainly serve as an inspiration to other people suffering with these issues.
I hope so.
And we look forward to ongoing health and wellness for you for the foreseeable future.
Thank you so much.
All right, you're welcome.